Welcome and thank you for joining us. My name is Lindsay Schlegel, and I am a healthcare benefits representative in the Office of Total Rewards. If you are watching this live, feel free to submit your questions using the Q&A or chat feature, as I am joined by coworkers today that will be able to answer questions as they come in. At the end of the webinar, we will stay on for as long as needed to answer all questions. On the agenda for today is a review of the changes for 2019, an overview of the healthcare plan design, and details on the open enrollment process. For the sixth consecutive year, the university will provide HSA funding for eligible faculty, staff, residents, and fellows enrolled in the HSA eligible plan. You are eligible for this funding if you are a full-time faculty, staff, resident, or fellow earning less than $52,000 per year. Eligible employees with a single plan will receive $200, and employees that are covering any dependents will receive $400. If your position qualifies you for the funds, you will also need to confirm that you meet the IRS requirements to contribute to an HSA. All eligibility requirements will be listed in HRMS on the open enrollment pages, but some requirements are: employee must be enrolled in your HSA eligible plan, cannot be enrolled in any other health plan, including Medicare, and cannot have a healthcare FSA. The complete list of eligibility requirements is available to employees on the open enrollment pages and on the Total Rewards website. During open enrollment on HRMS, you will be able to certify your eligibility, and the HSA university funding will be deposited into your HSA account in the last pay period in January. If you are enrolled in the HSA eligible plan, you may be eligible to contribute to a health savings account, or an HSA, which is a tax-free account used to pay for qualified medical, dental, and vision expenses. If you have an HSA account, you will receive a bank card which can be used to pay for qualified expenses at the point of service. So you can swipe your card at the pharmacy to pay for prescriptions and use it to pay your medical bills online or over the phone. An HSA is a bank account, which means it is fully portable. The balance rolls over year to year, and if you leave the university, you take the account with you. The idea being that if you know you will have medical expenses, you can use pre-tax funds to pay for those expenses. During open enrollment, you can elect an annual contribution amount, which can be changed at any time throughout the year. The amount you elect will be prorated based on the number of pay periods in the year and will be a pre-tax payroll deduction, and those funds will be deposited into your HSA account. New for 2019, the IRS is increasing the maximum contribution amounts. If you have single coverage, you can contribute up to $3,500. If you have one or more dependents, you can contribute up to $7,000. And if you are 55 or over, you can contribute an additional $1,000 per year. If you are enrolled in either the PPO or HSA eligible plan or waive health coverage altogether, you can contribute to a healthcare flexible spending account, or FSA. The FSA is similar to the HSA in that it allows you to set aside pre-tax dollars to pay for qualified medical, dental, and vision expenses. If you elect to contribute to an FSA, you will elect an annual contribution amount that cannot be changed throughout the year. Your election will be prorated based on the number of pay periods in the year and will be a pre-tax payroll deduction each pay period. When you have qualified expenses, such as a prescription, you would pay out of pocket at the pharmacy, and then you'd be reimbursed from your FSA either with a check or direct deposit. If you have health coverage through the university, your FSA vendor will have a record of certain qualified expenses and can reimburse you automatically. If you do not have coverage through the university, or if the claim does not get processed through your medical or dental insurance, for example, prescription eyewear, you can submit a reimbursement request directly to your FSA vendor. The IRS list of qualified medical, dental, and vision expenses is the same for both HSA and FSA and is called IRS Publication 502. A link to the document can be found on the Office of Total Rewards website. Important to remember, if you elect an FSA, a max of $500 unused funds will roll over year to year, and any funds left over above $500 will be forfeited. New for 2019, the FSA maximum annual contribution amount is increasing to $2,650. If you are enrolled in the HSA eligible plan and have an HSA, the IRS will not allow you to have a healthcare FSA. However, you can have a limited purpose FSA. A limited purpose FSA works similarly to a healthcare FSA in that you elect an annual contribution amount, which cannot be changed after the open enrollment period, and the amount you elect will be a pre-tax payroll deduction. The important difference is that a limited purpose FSA can only be used to reimburse qualified vision and dental expenses prior to meeting your Tier 1 deductible. If you meet your Tier 1 deductible, you can use your limited purpose FSA to reimburse any qualified medical, dental, or vision expense. The advantage to the limited purpose FSA is that you have access to your full election as of January 1st and can reimburse vision and dental expenses without waiting for funds to build up in your HSA. It can also help you build funds up in your HSA by allowing you to use your limited purpose FSA funds for vision and dental expenses rather than depleting the funds in your HSA. The limited purpose FSA contribution maximum for 2019 is increasing to $2,650. And like the healthcare FSA, up to $500 will roll over automatically each year. Any funds above $500 will be forfeited at the end of the year. The dependent care FSA is entirely separate from the university's health plans. This means you can elect the dependent care FSA regardless of your health coverage. The dependent care FSA allows you to set aside up to $5,000 per household to pay for qualified daycare expenses for dependents up to age 13 who are claimed as tax dependents or a dependent adult. Please review IRS Publication 503, which can be found on the Total Rewards website, to confirm your daycare expenses will be eligible for reimbursement. The dependent care FSA is similar to other FSAs in the sense that your annual contribution amount must be elected during the open enrollment period and cannot be changed throughout the year. Your election will be a pre-tax payroll deduction, and you would submit your reimbursement request directly to your FSA vendor. Important to note, the IRS does not allow a $500 rollover for a dependent care FSA, so any unused funds at the end of the year will be forfeited. As you may be aware, Group Optional Term Life, GOTL insurance, is no longer available as of 11/1/18 in favor of Group Universal Life, GUL insurance. Any current GOTL policies were automatically converted to GUL at the lower GUL rate effective 11/1/18. Beneficiaries, however, were not carried over, so action is required for employees previously under GOTL to designate a beneficiary for their GUL insurance in November. Your benefit extras, which include Hyatt Legal Plan and VSP Vision Insurance, will be offered again for 2019. The Hyatt Legal Plan includes prepaid legal insurance plan, which offers representation on various legal matters, including real estate and estate planning. The Vision Plan, through VSP, includes coverage for eye exams, lenses, and frames for employees and their eligible dependents. If you are enrolled in either benefit in 2018 and plan to keep the same coverage, then no action is required. If you are enrolling for the first time, want to make changes, or cancel the coverage, you must do so during open enrollment. For 2019, the healthcare plan has no major design changes. To help navigate open enrollment, we encourage employees to be familiar with the following terms: deductibles, coinsurance, copays, and out-of-pocket maximums. We also encourage employees to check out the 2019 health plan comparison chart to see a full picture of both plans. The HSA eligible and PPO plan both have a deductible. This is the amount you will pay out of pocket before the plan kicks in to pay for covered services. It is important to note that the deductible will work differently for each plan. For the PPO plan, the deductible will only apply to inpatient, outpatient, emergency room, and urgent care services. Office visits on the PPO plan are subject to a copay rather than the deductible. On the HSA plan, the deductible applies to all covered medical and pharmacy expenses. So you would pay the full cost or negotiated rate for any medical or pharmacy expense, excluding preventative services, prior to meeting your deductible. On either plan, if you meet your deductible, you will move to the coinsurance phase, which means the plan will kick in and pay a percentage of your expenses. So on the PPO plan, if you meet your deductible and then incur an outpatient expense such as an x-ray, the plan will pay the applicable coinsurance or percentage of the cost. The coinsurance will work the same way for both plans. If you incur a claim in the Accountable Health Partners Network, also known as Tier 1, the plan will pay 90% of the claim. If the claim is incurred outside the Accountable Health Partners Network, but still within the larger Aetna or Excel's national network, known as Tier 2, the plan will pay 75% of the claim. And if you incur a claim out of network, the plan will pay 60% of the claim up to reasonable and customary limits. The PPO plan also includes a copay, which is a fixed dollar amount paid at the point of service for office visits. So if you have an office visit with your primary care physician who is within the Accountable Health Partners Network or Tier 1, you would pay $20 for the visit regardless of where you are with your deductible. Both plans have an out-of-pocket maximum, which is the most you will pay out-of-pocket for covered services in a calendar year. Throughout the year, your out-of-pocket costs, including the amount you pay towards your deductible, coinsurance, prescriptions, and any copays, will count towards your out-of-pocket maximum. If you reach the out-of-pocket maximum, the plan will pay 100% of your covered expenses for the rest of the calendar year. Like your deductible, your out-of-pocket maximum will reset every year on January 1st. The PPO plan offers 3 tiers for providers to fall into. Tier 1 is referred to as the Accountable Health Partners Network and is made up of you of our providers, as well as a number of community physicians. All providers in the Accountable Health Partners Network are also in the Aetna and Excellis network. If you see a Tier 1 provider, you will have a higher level of coverage, so you'd have a lower deductible, lower copays, etc. Tier 2 is made up of providers that are within the larger Aetna or Excellis national network, and Tier 3 are providers who are out of network entirely. The difference with out-of-network providers is the level of coverage, so a higher deductible and out-of-pocket maximum. With regards to the PPO plan, there is a deductible that only applies to inpatient, outpatient, emergency room, and urgent care services. So if you have an emergency and visit the emergency room, you will pay the full cost of the visit until you reach your $500 deductible. If you already met your deductible for the year, you would pay 10% coinsurance, and the plan would pay the remaining 90% of the cost of the visit. If you see a provider as an office visit, you wouldn't pay towards the deductible, rather you'd pay a copay. So if you see your primary care physician, you'd pay your copay for the visit. If you receive any additional services, such as lab work, x-rays, etc., you'd pay towards your deductible for those additional services, as they'd be considered outpatient services. The HSA eligible plan works differently than the PPO plan, though both plans have the same 3 tiers, and the most notable difference is the deductible. On the HSA eligible plan, the deductible applies to all covered medical and pharmacy expenses. So that means you'd pay the full cost or negotiated rate for all medical and pharmacy expenses until you meet your annual deductible. If you meet your deductible, the plan will kick in and the plan will pay coinsurance, 90% for Tier 1 services, 75% for Tier 2, and 60% for Tier 3. If you meet your deductible, the prescription coverage will also begin and will mirror the PPO plan. $15 for a generic prescription, 20% coinsurance for a preferred brand drug, and 35% coinsurance for a non-preferred brand drug. For both plans, preventative services are covered at 100%, regardless of where you are with your deductible. If you have any questions about preventative services, please call either Aetna or Excellis to confirm that the service is considered preventative. And important to remember that UR employees receive an employee discount at the employee pharmacy. The employee pharmacy is located in the medical center, and they offer courier services to a number of off-site locations. Employees are encouraged to contact them directly with questions about the courier services. The open enrollment period is November 1st through November 15th. During that time, you can enroll for the first time or make changes to your benefit elections for 2019. You can change your health care plan and or your dental plan. You can add or remove eligible dependents. You can change your TPA, Aetna, or Excelis. You can elect an FSA or an HSA. Remember, your 2018 election will not roll over. You can certify your eligibility to receive HSA-UR funding. You may elect or change life insurance coverage. And lastly, you can elect, change, or cancel your VSP and or Hyatt legal coverage. If you are planning to elect health coverage, you will need to make 3 decisions. You need to choose a health plan, either the Your PPO plan or the Your HSA eligible plan. Then choose a third-party administrator, either Aetna or Excelis. Both Aetna and Excelis administer the plans in the same way. Most differences include the provider network and the drug formulary. And finally, you need to decide who you want covered on your health plan. There are 4 different coverage levels available for you to pick from. For information on eligible dependents and more details about each plan, you can use the Health Program Guide found on the Open Enrollment and Total Rewards websites. If you are enrolling in a new dental coverage or changing your dental coverage, you will need to choose a plan, either the traditional plan or the medallion plan, and you will need to choose your dependents to be covered on your plan. Excelis administers both plans, so you will not need to choose an insurance carrier. The annual open enrollment period is also an opportunity to make changes to your life insurance coverage. If you do not have optional coverage, you can elect Group Universal Life during open enrollment. If you do have coverage, you can increase your GUL coverage. Employees can apply for up to 8 times their annual salary of coverage, and specifically during open enrollment, employees can increase their coverage by 1 time their salary without proof of good health. For more details on increasing coverage, we encourage employees to visit the open enrollment website. Lastly, we strongly encourage you to review and update your beneficiary designations for both the university paid coverage as well as your optional coverage. When you are ready to make your elections, go to HRMS. This is where you will start to make all of your benefit elections. On your HRMS homepage, you will see buttons to use for health/dental benefits, Security and Financial for life insurance, and your benefit extras for VSP and Hyatt Legal. Remember, you will need to use the Duo tool if you are attempting to log into the HRMS site off-site. You can visit the IT website or call IT for assistance in setting up the Duo tool. If you have questions about the enrollment process or would like additional assistance, please call Ask UR HR at 275-8747. They can answer your questions and walk you through the enrollment screens in HRMS. There are 3 steps to the open enrollment process. Step 1, review your benefits. Take a look at your current coverage and use your insurance carrier's website, either Aetna or Excelis, to review your claims and costs over the past year to make sure you are in a plan that makes sense for your coverage needs. Review your dependents and make sure they will be eligible for coverage in 2019. Review your life insurance coverage and beneficiaries. Review your VSP and Hyatt legal coverage, and review open enrollment materials on the Total Rewards website. You may use the ALEX tool. ALEX is an interactive benefits decision-making tool. It will ask you questions about who will be on your plan, what types of services you think you might use, and will provide a cost comparison for each of the plans. ALEX will also walk you through a few scenarios to show you how the plans work in different situations. Step 2, choose your plans. Log into HRMS to make your elections. The HRMS homepage will have buttons to click to make your health, dental, FSA, or HSA elections, a link for Security and Life for life insurance, and a separate link for your benefit extras to elect VSP and or Hyatt Legal. Very important, if you want an FSA or HSA, remember to make a new election for 2019. Your 2018 contribution will not roll over. Step 3, watch for your confirmation items and detailed confirmation statement in December. Confirmation items include HRMS will send an email confirmation for health, dental, FSA, and HSA elections. For Securian, If you choose to receive information electronically, you will get an immediate email. You will also receive a new or updated certificate of coverage in the mail in January if you are increasing or decreasing your coverage. For VSP and Hyatt Legal, you will receive an immediate confirmation email. You will also receive a VSP evidence of coverage and/or Hyatt Legal Plan certificate of coverage in the mail in January. Employees will also receive a confirmation statement from the Office of Total Rewards that details all benefit elections. This will arrive in the mail in December. Employees are strongly encouraged to keep all confirmation items in a safe and secure place in case needed during the plan year. If you have questions about the open enrollment, contact Ask UR HR. You can also stop by an open enrollment Q&A session or help session. The schedule is on the open enrollment website. Total Rewards websites also has videos, and the ALEX tool has resources to help employees make their benefit elections. At this time, that concludes our webinar today. Thanks for joining us, and we will keep the webinar open for any questions that continue to come in.